I was born and raised in Russia, and then I moved in the United States about 10 years ago, where I pursued my postgraduate training. I did my residency training up north in Connecticut, and then I moved to University of Florida in Jacksonville, where I did my general cardiology training. After that, I did go to Cleveland Clinic to get a specialty training in advanced heart failure, mechanical circulatory support, and transplant cardiology. CHF is a very broad term. It basically means that a heart cannot deliver enough blood to your body to function properly. Generally, we divide it into two big categories. One is when your heart is too weak and you cannot perfuse your body. Another one is when your heart is too stiff and you cannot fill your heart. Treatments are completely different for those two groups of patients. Normally, those patients are cared for by internists or general cardiologists. But when time comes and they progress to what we call an end-stage heart failure, they come and meet with us, advanced heart failure cardiologists. What we do here in this clinic, evaluate patients for advanced therapies. Advanced therapies not necessarily mean a transplant. Transplant is usually a gold standard for treatment, but is a last resort that the patient has. We also offer LVADs. It's a short term for ventricular assist device. It's a durable pump that is fully implantable into the patient's body. It goes in the top of your heart and it functions just like a simple pump that drains blood from your left ventricle into the aorta. LVAD is a surgery that is performed in the operating room. Any conference right now that you go in the world, we're trying to find a cure for those patients. We do have several research trials, and our patients have availability to join the trial. We have a monitoring system for those patients that has been approved by FDA, and we implant those tiny monitors in their pulmonary arteries to monitor their fluid status. So all the patient has to do is to come for a somewhat simple procedure, and every day physician can have an access to pulmonary artery pressures that their patient's having and adjust their medications even remotely. Those patients would have a special pillow with a Wi-Fi technology to transmit data to our office for us to easily adjust the medications and keep those patients out of the hospital. Amyloidosis is progressive disease. Now we have special medications to treat that condition. However, if a condition progresses in rare circumstances, we do offer a heart transplant for patients with amyloidosis. It can be also an option for them. Every time we have to deliver a message to our patients that they do have heart failure, that is definitely a scary diagnosis, mainly because of the word failure. There are a variety of treatments that can improve the survival and improve the symptoms. All my grandparents were doctors. It happened so that when I was pretty much raised by my grandmother, who was an internist and working, taking extra shifts in the emergency department, I've been exposed to this atmosphere since I can remember myself. I really fall in love with basic science such as biology, chemistry, anatomy, and what fascinates me is how science can be translated into helping someone else. I'm a firm believer of mentorship. And mentorship in development of doctors and any type of specialists. All my mentors throughout my medical career were doctors, and they were cardiologists. And for me, it truly was not a question who I would like to be. I wanted to be a cardiologist. So I'm a soccer fan. I love hockey, but I also love opera. My wife and I are opera fans, and every time we have a chance, we try to go and see an opera wherever we travel. We love to go to Metropolitan Opera in New York, and pretty much a couple seasons of Metropolitan Operas when we lived up in Connecticut.